For years, if you had knee pain from arthritis, you were told there were really only two options: pain medication or an exercise program most people struggle to stick with. But a new clinical trial just published this month suggests there may be a third option, and it has nothing to do with your knees at all. It starts in your gut, and it costs about as much as a bag of oats. If you're managing knee pain or watching someone you love slowly give up activities they used to enjoy because of it, this isn't just an interesting headline. It could change what you try next, and it might be far simpler and far cheaper than anything you've tried before. So what did researchers actually find? Let's start with what this tends to look like in real life. Picture a woman named Margaret, not a real patient, just an example of how this often unfolds. Margaret's knee OA had slowly taken away her morning walks with her neighbor, a routine she'd kept up for almost a decade. She'd tried anti-inflammatory medication, which helped a little but upset her stomach enough that she used it sparingly. Her doctor recommended a physical therapy app, but between the exercises, the screen time, and the days her knee simply hurt too much to start, she'd stopped logging in after 3 weeks. She wasn't lazy and she wasn't unmotivated. She was just like most people managing a chronic condition. Real life and a body that doesn't always cooperate got in the way of a program that demanded daily discipline. Or take Robert, a retired teacher who read about a trial like this and honestly rolled his eyes a little. He'd been managing knee OA for 6 years and had heard plenty of supplement claims that didn't hold up. Still, adding a spoonful of chicory root fiber to his oatmeal cost him nothing and took 10 seconds, so he figured there was little to lose. He wasn't expecting a transformation and he didn't get one. What he noticed a few weeks in was more modest, fewer of the mornings where his knee felt too stiff to bother with a walk. That's a realistic version of what evidence-based incremental change tends to look like. Not a miracle, just a little more room to move. That's the exact gap researchers at the University of Nottingham set out to address. Their trial, called INSPIRE, was published in the journal Nutrients this year. Researchers screened over 700 people and enrolled 136 adults with knee osteoarthritis. After 6 weeks, 117 completed the study. Participants were randomly assigned to one of 4 groups: a daily 20-gram dose of inulin, a digital physiotherapy exercise program, both combined, or a placebo made from maltodextrin, a neutral filler with no known effect on the gut microbiome. Interestingly, combining inulin with the exercise program didn't clearly outperform inulin on its own, which is part of what made the fiber-only results stand out as much as they did. Here's the part that surprised even the researchers. The group taking inulin alone saw a meaningful reduction in knee pain, along with improved grip strength and lower pain sensitivity overall. And just as notably, almost everyone stuck with it. Only about 4% of the inulin group dropped out of the study, compared to roughly 21% of the group assigned to the exercise program. For a chronic condition where the biggest challenge is often sticking with treatment long enough for it to help, that adherence gap may matter as much as the pain relief itself. So, why would a fiber supplement affect a joint on the other side of the body? This is where it gets genuinely interesting. Inulin acts as a prebiotic, meaning it feeds the beneficial bacteria already living in your gut, rather than being digested itself. As those bacteria break it down, they produce compounds called short-chain fatty acids, including one called butyrate, which appears to influence inflammation and pain signaling well beyond the digestive system. Researchers also measured a hormone called GLP-1, the same hormone behind newer diabetes and weight medications, and found that participants with higher GLP-1 levels after taking inulin also showed the biggest improvements in grip strength, hinting that this gut-driven hormone may play a role in muscle function too, not just appetite. Dr. Aphrodite Kuraki, the study's lead author, described this as evidence for what researchers are now calling a gut muscle pain axis, a growing recognition that the trillions of bacteria in your digestive system may influence far more of your body than digestion alone. Think of it less like your gut being a separate room in the house and more like the electrical panel in the basement. It doesn't look connected to what's happening upstairs, but flip the wrong switch down there and it changes what's working everywhere else. A joint that hurts isn't necessarily a problem contained entirely within that joint. Now, it's important to be clear about what this trial does and doesn't tell us. This was a 6-week study with just over 100 completers, which is a meaningful sample for an early trial, but still small compared to the kind of large, multi-year research that eventually changes standard medical guidelines. It's promising, but it's also one trial, and the researchers themselves note that longer studies in more diverse populations are needed before this becomes a standard recommendation. It's not a cure for osteoarthritis, and it's not a replacement for the treatment plan your doctor has already put you on. What it does suggest is that a low-cost, low-risk addition to your daily routine might meaningfully help alongside whatever your doctor already recommends, not instead of it. That distinction matters, especially with joint pain, because osteoarthritis is a slow, progressive condition that tends to get worse without some form of ongoing management. It's the kind of thing where anything truly low risk and evidence-backed is worth knowing about, even if it isn't a complete solution on its own. So, what does this mean for you today? If you're managing knee osteoarthritis, this is worth bringing up at your next doctor's visit, particularly if daily exercise programs haven't been sustainable for you. Inulin is naturally found in foods like chicory root, Jerusalem artichokes, garlic, onions, leeks, asparagus, and slightly green bananas. So, getting more of it doesn't necessarily require a supplement aisle. A daily serving of 1 or 2 of these foods added consistently rather than all at once is a reasonable place to start. That said, if you're considering a concentrated supplement closer to the 20-gram dose used in this trial, talk to your doctor first, especially if you have irritable bowel syndrome, a sensitive digestive system, or any condition affecting your gut, since a sudden jump in fiber intake can cause bloating, gas, or discomfort for some people. Starting with a small amount, increasing it gradually over a couple of weeks, and drinking enough water alongside it tends to be the more comfortable approach, and it's the same general advice that applies to increasing fiber intake of any kind. It's also worth remembering that gut health research in general, beyond just this one trial, continues to point toward the same broader idea. What happens in your digestive system doesn't stay there. Diets rich in fiber and diverse plant foods are consistently linked to lower inflammation throughout the body, which matters for joints, for the heart, and for long-term health more broadly. This trial adds a specific, measurable data point to that larger picture rather than standing apart from it. None of this means you should stop a medication or skip physical therapy your doctor has recommended. Osteoarthritis management usually works best as a combination of approaches, not a single fix. And what worked for the people in this trial may not work identically for everyone, since every joint, every gut, and every person's overall health picture is a little different. But for anyone who has struggled to stick with an exercise program or who is looking for something evidence-based and low risk to add alongside their current care, this is a genuinely promising, well-tolerated option worth a real conversation with your doctor. Here's a question worth sitting with. If something this simple, a spoonful of fiber in your morning yogurt, could meaningfully ease pain you've been managing for years, would you have guessed the answer was sitting in your gut the whole time?